To begin, thank you so much for coming today. I am Sarah Dalglish, speaking on behalf of co-PI of this project, Audrey Prost, who many, if not all of you know. I'm just going to introduce the speakers and hand it over to them. First, we'll be hearing from Dr. Kwame Sakyi, who's taking his place here, Associate Professor at Oakland University and Director of the Center for Learning and Childhood Development in Ghana. At the same time, we'll be hearing from Professor Raul Mercer, pediatrician and coordinator of the program for social sciences and health at FLACSO in Argentina. We are lucky to have with us Professor Kara Hansen, professor of health systems economics at the London School for Hygiene and Tropical Medicine, dean of the Faculty of Public Health and Policy, and also director of the Global Health Research Program at NIHR. I would also like to note that joining us online, we have Joe Lunn, research manager at NIHR. And in person, we're lucky to have Director Florence Aisi-Korte of the Ghanaian Ministry of Gender, Children, and Social Protection. Thank you to everyone for joining us. And without further ado, I would like to hand it over to our speakers. Kwame, Raul.
I don't think so.
Yeah, for the online participants.
So, we wanted to start something from our language a little bit to kind of welcome you. So, you need your piece, I mean, so I'm saying, we're so glad that you're here. You're looking beautiful, and we love being here. All right, over to you.
Bueno, buenos días. Mi nombre es Raúl y también, como dijo Kwame, es un placer para nosotros la presencia de ustedes y estar en este ámbito que consideramos que también es una oportunidad de carácter excepcional para poder compartir nuestra experiencia con ustedes. I'm saying that it's a pleasure to have you here. And it's an opportunity to share our experience with you. This is our first time that we have this kind of experience. So we'll try to do our best.
Yes.
Well, this is the presentation outline. Imagine that you are doing a trip and we are going to move along this intense experience that we are developing. First, trying to go to explain some of the background of who we are, where we're coming from. At the second level, we are going to have another project overview. What are we working on now and what have we done so far? And which are the implications? Where do we go from here? And although it's not written here, we expect to have room to get your views, your feedback, your questions, criticism, anything. So,
okay. So we wanted this to be a dialogue, so that's why we're going back and forth. So don't get confused. That's why you also kind of have a blue and a green one. So I hope you are you're still stable. So beyond that, we want to have a dialogue. We have to have a shared understanding between us, even though we might be from different countries. We look a little bit different. I am a little older than Raul. We have a lot in common that we want to share with you. At the very core of it, we love children. We don't want to have a lot of them, but we love them. They keep you awake all the time. So at the center of what we love is also about children, and we have that in common. Raul always say that there's so much going on in the world, and sometimes you're only looking at differences. But today we are hoping that with the integration, you'll be able to see some similarities between Ghana and Argentina. Okay.
Well, let's go for the first stage of this presentation regarding who we are and where we're coming from. So something about FLACSO. FLACSO is the Latin American School of Social Science. We are based in Latin America. And FLACSO is the result of an agreement between UNESCO and the governments of different Latin American countries. And you can see in that graph, we are based in 14 Latin American countries, and that includes the headquarters that are located in Costa Rica. And we are here in the very south of South America. And both Pablo, who is here, and myself, we coordinate an area that is the area of human development and health. he coordinates the program of human development, and myself, in my case, I coordinate a program of social science and health. We try to approach health from the social perspective, including rights, equity, life course perspectives, and also with an emphasis in child issues, and of course, early child development.
So CLCD was co-founded by myself and my colleague at the back, Prince, and then Trinity Leonie over there. And I think we come a very humanitarian background, and we didn't. Oftentimes, when nonprofits are working, they come, they donate something, or they create a borehole, and then they have water, and then they leave. We thought that one way of solving social problems is to look at the underlying systemic issues. So we thought that research would be a good tool for helping us understand why children are not developing, why they were dying quite a bit in our country. And then once we found the research, our ability to be able to advocate for children. So we are a nonprofit, and we focus on research and advocacy. And our goal is not only criticize and think through, but to really make academic work very practical in solving real world problems. When you come, we are talking about babies all the time, like preterm and low birth weight babies, or we are looking at children with disability, as you will talk about later. And then we are very passionate about training a new generation of individuals and focusing a bit also on disability.
What do we do? Well, as you can see, it's just some vignettes that represent some of the areas that we are working on. On the very left, you can see a recent published book that is entitled in English, what is mine, and what is yours is mine. And this book is based on the present political situation in Argentina in terms of how this is affecting human rights as a response to neoliberal perspective that is affecting not only Argentina, but some other countries in the world. Particularly, we wrote a chapter on how these policies are influencing the particular situation of children and adolescents in Argentina. There's another book on child poverty in the region. There is another on health and health policies where we had a chance to incorporate a chapter on equity from the start, recognizing that the inequities they start as early stages of life and all the contextual issues act in favor to perpetuate all these particular situations. No, yes, no.
I need to let somebody in. Please forgive me.
Yeah.
You can do it? Okay, excuse me.
May I continue?
Yes.
On the lower part of the graph, you can see promoting rights on health. That is something that we working almost 8 years with UNICEF, working at healthcare facilities on how to translate the Convention of the Rights of the Child as a tool for health practitioners. And these are recent publications on how to promote early child development at the community level, working with indigenous communities.
At CLCD, when we started, what we also wanted to think about is not only thinking of developmental delays and disabilities over time, but we also want to figure out how do you create an environment where you're preventing some of them from happening. So we study a lot of preterm and low birth weight babies. So one of our projects has to do with, this one has to do with mortality growth, neurodevelopment, but we are combining, India came out with a tool. It's called the BEMPU bracelet, and it detects when kids are hypothermic. And as you know, it has all different clinical implications. But what we're also doing is that mothers and caregivers and fathers who had preterm babies have a lot of experience. So how do we leverage on that to be able to teach new mothers, new fathers, and new homes how to care for very preterm babies? We're also using machine learning. So we are using the everyday data that we collect at our hospitals to see if we can use machine learning to create models for predicting neurodevelopment in preterm babies. We also think that when it comes to when kids are delayed and have a disability, it shouldn't be the work of only women. And we need to be able to recognize and value that. So we are working with government agencies to create an environment of how do we tackle unpaid care work. And then the ministry is also here working around ECCD policy and implementation.
These are another examples of what are we doing. On the first line, you can see a set of publications that are based on the mapping process of institutions that provide service for early childhood in different provinces of Argentina. And on the lower part, you can see an ad of an issue, of a topic that we are working very strong for the last years. And this is a result of their last report on the importance of commercial determinants of child health as a trigger for many problems that affect not only childhood, but also what will come in the future in terms of the epidemic of non-communicable diseases.
As I said, we thought that you can't just only do research without making it also very practical and finding solutions to them. So when we do research, we use it quite a bit for advocacy campaigns that we do quite for inclusion and having children with disability in schools. We also run a rehabilitation clinic because we realized that most of the children within 6 months of receiving a diagnosis, they leave the hospital and they stay at home. And then they have to carry the child, in Africa, you have to carry the child on your back. You go here for physical therapy, you go over there for occupational therapy, and it wears on you. And so we thought, why don't we centralize services? So we do community rehabilitation for different forms of disability. And I also told you about, we train students in global health and global child development during the summers.
Oh, we do it well. So you're traveling very fast from Ghana to Argentina. So if it's too fast, just let us know.
Let us know. Yes.
Okay. So let's go to the second part of the presentation, that what we are working on now and what have we done so far. So these are, again, vignettes and images of Argentina. Argentina is a very complex and complicated country. We are a federal country where you divide into provinces, and depending where you are, is what you're going to get. What I can summarize is that Argentina is not Buenos Aires. We build our image or our stereotype of Argentina through Buenos Aires. That's the capital city. The harbor was there. Historically, Buenos Aires concentrated the power, the wealth of the country, but fortunately, we are more conscious that there are many Argentinians, and the other difference is that the people from Buenos Aires used to see Europe as the goal, and the rest of the provinces, they were more based on the Latin American perspective. Fortunately, the present situation is helping us to recognize where we are, and they need to be integrated, although the political environment is not friendly in this particular moment.
Does anyone like chocolate? Chocolate? Okay. So if you're eating chocolate, more likely you're eating something from Ghana. So we produce the cocoa that they use to turn into chocolate. So we are the second leading producer of cocoa. So in terms of that. But Ghanaians are very good at planning. And one of the things you're very good at planning is funerals. If you die and you want a really good funeral. So, most of the world is very, very boring. They put you into this thing, put you in the ground, and you're rotten. But Ghana, we say, want to be artistic. So this is a coffin made in a shoe. So I said, when Raul dies, this is where he's going to put it. So
actually, if you come here, you can see that there's room for two.
Room for two, yes. So if there's room for two, there's room for two here too. We wanted to give you some contrast of how Ghana and Argentina looks like, because it will form the foundation of what we're going to talk about over time. So the things that appear reddish, or I don't know, I'm colorblind sometimes, things that the numbers are bigger. So it's higher in that place versus the other. The ones that are purple are the ones where the numbers are a bit lower than the other ones. And then when it's blue and green, which is the colors that we've been using to represent, so they're almost about the same, you can't rank them. So why don't you take a minute, look at this one. What stands out to you? What do you see?
Argentinians are better at football.
Yes. They're more
Perfect.
very good. Yes. They won the World Cup 3 times.
With the hand of God.
Yes. Exactly. Yes.
We still feel bitter about it.
I don't feel well.
So apart from World Cups, what else do you see? What else do you see?
What's one Ghana land mass?
So we are saying that when you rank the world in terms of you take one Ghana to make 11 Ghana to make Argentina. So Argentina is 11 times much bigger than Ghana. That's the 1 in the 11. Argentina's economy is much bigger than Ghana. Politically, we are kind of relatively stable relative to Argentina. In terms of inflation rate, it's almost about similar. And then what is really interesting is that we're going to contrast Argentina and Ghana. In Ghana, we already have an early childhood development policy, and Argentina is also beginning to do its own. But you see these differences. There are about 24 provinces. There are about 16 regions in Ghana. But what is really critical for you to look at is a form of governance. Argentina is a very federal one. Ghana is a unitary one. So if I want to do something, I have to go see the minister, then go to chief director, and you go to the director, and you go to program officer before you go to the. So there's a lot of layers, but it also has its room for helping us do different things.
The last slide, we made the correction because the original one was the inflation rate was extremely high, 10 times this figure. But now, although there's a balance in those figures, it doesn't mean the situation also improved for most of the population.
Just on, are the definitions of poverty rate the same across the two countries? That slightly surprised me. That's how much in so
What's your country
No.
per capita income must be?
Much higher.
More than equal.
The unequal. That's what Raul tells me. It's unequal rate. All right. So Raul, your team.
Well, to build this project, we had to create a team with some different characteristics. First, to bring people who are really expert and well recognized in their own fields. Second, that they represent critical areas related to early child development. But we know that early child development is a complex issue. This is not something that is related with health exclusively, and that health is so complex that it shouldn't be on the hands of physicians only. I'm the physician. So that's the reason why we consider that this complex issue should be approached in a very integrated and comprehensive and interdisciplinary manner. Second, we want also to reflect the situation that we work to work in terms of bringing intersectoral approaches based in science perspective. So that's the reason why we created this interdisciplinary team as a mirror of what does it mean to work on an intersectoral basis. And as you can see, I will not say the names of the people, but the areas that covered are early child development, health, nutrition, child participation, child protection, environmental issues, information, intersectoral policies, economy and financing, monitoring and evaluation, and also good things that we have done, we are convinced, is that we include in our team members of the municipality. And these people were hired and sponsored by the project. And this is an important issue to have someone that is related with both the municipality and our team in FLACSO to act as a facilitator and as a way to link both institutional levels.
We have more people than here, but those are listed here are the ones who are here. But what I want to draw your attention to is that the way we approach intersectoral is it's a partnership between us and the government. And so we are very, very interlinked in the way that we work. So in Ghana, the ministry responsible for children's welfare and early childhood development is called the Ministry of Gender, Children and Social Protection. And we are so lucky to have the head of policy over here. Director, you want to wave your hand? We've been trying to learn quite a bit. And then the senior member who oversees all ECCD programming is Ms. Pearl Peters over there. So those are and then our colleagues who are managing so many different things. Okay. Yes. All right. That's I hope you liked it. I could tell Anthony was surprised. It's like, it's Anthony there. Where do I put him?
Stop it.
Done.
Yeah, I want to make it bigger. Like this one, you know.
So I want to give over to Raul. We showed you that to kind of begin to tell you where we started from so that you have a context for understanding where we're going.
Well, just to let you know, we started almost in the year 2018. Well, we are part of Anthony's idea, Sarah's idea, in terms of bringing together many professionals from different parts of the world that we didn't know each other. I met before Anthony because we had a chance to work in a couple of projects before. So it was a result of a networking process where we had to decide which are the main challenges that children at the global level have to confront in these days. We know that infant mortality is going down, but the issue is not only to reduce infant mortality. The question is how to provide better life conditions for the majority that survives. And this is the challenge. And in this work that we have spent almost 2 years to get a report, we established or we defined that one of the two main threats that affect childhood at the global level are the climate change and the commercial threats that children have to deal with. And also, they need to recognize that according to the ODS or SDGs, there is a movement from survival to development, to thrive, and then to transform. So we are in the process of transition of the paradigm, and this is, although it sounds logic, when you go to the countries, it's very difficult because to change policies and to change institutions and to change the way of thinking is something that is not easy. Just for your information, we launched this report on the same day that the pandemic, the pandemic and Tedros, I mean, the director of WHO, was concerned because the virus started to circulate and we were witnessing all what happened. And in some way, the report was blurred or hidden by this particular phenomenon. So we had to fight with this particular situation and to try to give visibility. The good news is that as a result of this project, a new project came out 2 years later that is called CAP 2030, that means Children in All Policies. And the idea is to bring different countries from different regions of the world that were interested in issues related with child development, with adolescent health, with environmental issues, with child participation, with political economy. So as you can see, those are the countries that are part of this CAP 2030. All this information you can check and you get more detail and information at the website. And one of the other outcomes of this effort was the design and implementation of a dashboard that was a joint effort between UCL, between WHO, and between UNICEF. So it was one of the unique experiences in the history that these institutions decide to work together and to use the same tool. And what is interesting is that although the tool is almost done, there is now a stage of debate in terms of how to adapt this tool, not only at the national level, but also at the subnational level. And this is our interest of both Ghana and Argentina to adapt this tool for the municipal level based on the general principle of this study and also the information needs of the participating municipalities.
We know we talked about our team, but I want to also really recognize UCL's team because a lot of the brain behind it and a lot of the funding behind it, Anthony had played a great role. Sarah has been my closest friend. I always kind of stay close, but and Audrey has been just fantastic problem solving, helping us think through things. So we are not here because we got here, but we're also standing on their shoulders to be here. So thank you for that. As you know, you didn't know when I graduated, but when I was studying, reading Anthony's papers in PhD school, we were obsessed with neonatal mortality because it was stagnating, we weren't making any progress, and so the world was worried about that. Over time, we saw an evolution of reduction in child mortality. In 2018, Elizabeth, who was looking at global estimates for developmental disabilities, was estimating that today is 10 times more likely for a child to have a developmental disability than to die in the first 5 years of life. At the same time, estimates were coming in, about 43% of children in low and middle income countries were at risk of not reaching their developmental potential. So early childhood development became something of greater significance. If you think of early childhood development and these issues are arising, how do you go about solving them? So UNICEF and WHO came up with this idea in a group of scientists that the idea is called nurturing care, which is the concept that children don't need a very holistic approach in the way that we address their needs. So they need good health, adequate nutrition, responsive caregiving, safety and security, but they're not thinking of it in sectorial approaches, but in an intersectorial way, that if we're able to do that, we can get children to be developmentally on track. If you look at this one, you realize that there are many sectors in any country that does different things for children. But we realize that how do you then bring all of them together to have a common vision and to be able to address the needs of children? There's limited evidence on what is the best approach to do that in low and middle income countries. And what we have learned is that when you look at a decline in child mortality, some of the declines can be attributed to interventions that were happening outside of the health sector in close collaboration with others. Children are really, really important, and we need to have the ideas expressed in the things that we do. I remember my own son, he's about 5 years old, and one day I was taking him to the park, and he didn't want to go, and as a parent, I thought I knew better. So I was forcing him to go, and he sits in the car, put the key into the car, and then the car is locked. I left out, and the car is there, and he's 4 years old. You can't open the thing, and I'm panicking. I'm living in the US, I'm an immigrant. My wife goes, "Oh, Isaac is stuck in the car. So let's call the police." I said, "Why, you want them to turn you home or something?" I was, "Please don't do that." Anyway, eventually I came out. She still called the police anyway, and then she came around. But anyway, it's my anecdote of saying children have such a unique perspective in the way they think about things, in the way we do things. So in Ghana, we take videos of children expressing their views and adults, and it will surprise you how similar sometimes they are. When we are thinking of intersectorial, what exactly do we mean by that? When you're bringing coalitions together, what exactly are they going to work on? So when we talk about that, we are thinking about the root of work. So think about governance, think about data systems that they need, think about service delivery, think about finance, think about human resources, and think about stakeholder engagement. This is coming from WHO, one of its frameworks. How many of you like group work? It's cool. Audrey. But if you're part of a group, as a professor, they will come, this person is not pulling your weight if this person is there. Working in a group can sometimes take us far, but it can also be very. So what are the best approaches for us to work together, and what systems lead to the best outcomes? We have told you about how different Ghana and Argentina is in terms of both political and economic size. So when you have different governance system where you don't need to go to the state and the national level, but you can go directly into the municipalities or local level, how does intersectoral collaboration look like than say in a place like Ghana where you go from the top to the bottom? What is the difference? How do they form, and how do we make impact? So how do we want to study this from a research way? The first one is we want to fully understand, are there types of intersectoral collaboration that works? How does the governance structures work? If we're able to figure out once you have a good intersectoral collaboration going on, a coalition going on, how does it really lead to better outcomes for children? What is the process? What is the mechanism? What is the pathway to get there? And then stakeholder engagement and child participation. Not everybody values the opinions of children in policy and decision making, and sometimes communities are not necessarily involved. How do you study that in, say, Ghana and Argentina, and what lessons do we learn? NIHR, which is our funder, is very passionate about, we are not just studying for the science of it, but we want to create a new generation of individuals that really want to do intersectoral work. So how do we create a system where we have institutional learning over time?
So again, here you can contrast the different regions or the countries that are participating in this project. For Argentina, as you know, we are working on a municipal level, and we choose 5 municipalities, although there are 2 that merge, that represent 5 different provinces that are located in almost close to the central part of the country: Santa Fe, Buenos Aires province, this is La Pampa, this is Neuquén, close to the mountains, and this is Mendoza in the frontier close to Chile. Why were these municipalities are part of this project? Well, we have to establish certain prerequisites to be part of the project. First, the political will. If the mayor is interested in children, well, this is a good reason why we should go there. Second, to have a history of doing things considering children at the center of the policy making process. Third, to have practitioners or professionals who are well trained, who have a very good capacity to do teamwork and to organize. And also, from our perspective, is also to have a sort of a facilitating environment to approach these places. So there are differences in the territories, differences in the political party that is leading each of the municipalities. The children are not responsible who is to which party belongs the government, but when we know that independent who is leading each municipality, the point is the commitment, recognizing children as key social actors. Mm-hmm. The other issue has to do with the population size. There are municipalities of less than 50,000 people and those who have more than 1 million. It doesn't matter, because for us, heterogeneity is a source of learning. So we are based on the difference, we recognize the difference, and we understand the way of building intersectoral approaches and responses vary according to the particular and contextual situation of each municipality. So these are the reasons why we decided to work with these 5 municipalities, although we have more than 2,000 municipalities in Argentina, as we mentioned before.
Yeah. Several years ago, the British came to Ghana and decided to colonize the country. And when they did that, what they did was that it created a lot of their forts and their residents in the central and a greater part of the country. So when you think of slavery and the transporting slaves and all those kind of, quite a bit was here. But what it does is like honey. If you pour honey down, ants grow to it. So they developed this part of the country quite a bit. And so our capital is around here. So a lot of the resources in the country is concentrated in the southern part of it. So as you move, it gets more poor in one way. As you also move up, the population gets smaller. Ghana also used to have 10 regions, and they decided to split it from 10 to 16. So a place like this where colonialism started and lived for a very long time have structures that are very, very different from a place like, say, this place where they are forming a new state or a new, so their structures may not necessarily be very, very strong. So if you want to look at governance, the roots that I was showing you, how does the governance structures and the resources that are not here, how does it compare to the way that this one does? So we chose them on the basis of population size, on resources, and then having geographic coverage.
Well, in terms of the overarching goal of the project, is to create and evaluate a policy intervention that builds intersectoral coalitions to promote early childhood care and development at the subnational level. But we brought this nickname as a subproduct of the original umbrella project that was CAP 2030, do you remember? Mm-hmm. And after discussion of all the participants, we came out with EPIC, that means engaging policymakers in intersectoral collaboration for children in early childhood. If you use this same acronym, it can be used also in Spanish. We have to try without language.
Yeah, try it. Try. Say it in Spanish.
We have a 5-year timeline that for us, at least from the Latin American perspective, is a lot. Just to have the possibility to develop prospective thinking 5 years ahead. In countries like Argentina, that are very unstable from the political, from the social, from the financial point of view. So this project provides a sort of protective environment to try to think together on a common basis, having a common goal, but recognizing the differences. Mm-hmm. And as you can see, we have the settings based on Argentina and Ghana, that although before coming here, they were totally separated, totally distant, and our interest is to be much closer to each other, and the experiences that we are having these days here in London is unique. Mm-hmm. In terms of understanding that we share the same house, the same land, the same planet, and that when we talk about children, there are no borders, because children are subjects of rights and they deserve the same rights independent of where they live, if they are poor or not, and where they're based, and all the cultural differences. So the idea is to create the sense of belonging, and we understand that this is a good contribution of globalization.
Mm-hmm. If you pay taxes in the UK, I want to say thank you because you're funding. You're funding our work. I want to appreciate you for that. To give us the room to have 5 years to work, I really appreciate. I wish our country can do that for you, but we really appreciate your kindness to us. So you might not be able to remember all the things that we're going to tell you about this project, but there are 3 things I want you to remember. The first one is research. We are trying to study how intersectoral coalitions work to advance early childhood development in low and middle income countries. That's one. For you to study this one, you need a mechanism. So we are also implementing an intervention, which is what we call our policy development process. So that's the second element of this one. And then the third one is the capacity development. So we have research, policy, and then capacity. And so that's what I'll go in through that. Okay.
No, just a short comment. Although NIHR, we recognize that this is a research institution, we have to be clever enough for how to bring these processes at the municipal level. Mm-hmm. That we are not going to do research and use them as a laboratory. But our purpose is to use research and evidence and knowledge to improve the policymaking process. And this is a very important contribution, significant in terms of taking the best decision in terms of the main goals that
creating parks and things for, and then inadequate facilities at our school. All right, Argentina.
I'm sorry, this person that came here,
He wants to do
No,
child
I-
participation.
Nobody will have my moment.
from the Argentina point of view, we had an activity this morning on child participation, and we had the opportunity to learn about the Ghana experience. And we mentioned some characteristics of what does it mean child participation in the Argentine context. Considering that participation in general and child participation in particular is an expression of the kind of building process of the democracy. We were under dictatorship till 1983, and now we are moving forward the consolidation of a democracy. And we understand that if you want to build a real democracy, this real democracy should be based on the foundation of the rights, of human rights, although they are now in conflict in this present time in Argentina, based on the particular orientation of our government. But we know how much does it take, what's the duration of the gestation period of the human being. But I have an answer of how long does it take to gestate a democracy. So this is something I'm conscious that I not see my country living in a total democracy, because we are paying the cost of living under an autocratic governments. But fortunately, what we can see at the municipal level is, as a result of the decision of the policy makers and the leaders at the local level, there are spaces for child participation, and together with these spaces, many ideas. One significant contribution that this project can do is to think the component of child participation with a science-based approach, not just a declaration as a will, as a dream, but also how to add science to child participation issues with all what it means. Over.
Okay, so funding. When we go to our local districts, all the thing they're asking us, how do you fund this beyond money from the government? How many of you see Shark Tank? It's a US, have you seen Shark Tank? Okay, so so Shark Tank, you come up with an innovation and your investors will sit there and you go and you pitch your idea to them, and then they decide whether they want to invest money into it or they don't want to invest money into it, and they rip you apart sometimes. So we're taking that idea so that the municipalities that create their own plans, we are bringing private sectors, international donors, government, bringing them in a room, and then having the municipalities come and pitch what they want to do for children. Sometimes it's not always about money. Sometimes they need chairs for their offices. Sometimes they need computers. Sometimes they need internet bandwidth. Sometimes they need something else. So when they come and they articulate what they are, we're trying to see if that model can be something that could be replicated for funding purposes. Okay, capacity development. Argentina.
Well, as part of the project, part of the agreement we signed with UCL-NIHR, we are responsible to add a training component, and for this purpose, we have a room for one PhD program. Our candidate is here, Antonella. Raise your hand. As we mentioned before, we have a postgraduate course on commercial determinants of child and adolescent health with a life course and rights perspective. And the idea is to strengthen institutional capacity at the municipal level based on training needs and a plan of action. So now we are finishing our situation analysis. After this, finishing this part of the evaluation of the study, we will have the chance to develop an action plan for each municipality, and we will detect or will find the main problems that need to be approached and how the strengthening capacity should be applied in terms of training or any kind of approach. As you know, intersectorality, there's no scholastic way to learn intersectorality, but you have to live intersectorality and to understand what it means. So this is also a challenge for the project to understand different ways to approach this complex concept in terms of bringing intersectorality to real life?
For us, we have two postdocs. One is based in UCL. He's almost like a professor right here. Carlos, Carlos has been giving us philosophical thinking, so I can keep up with him sometimes. So smart. And then in Ghana, we also have one, and we also are bringing two PhD students. One of them, we like her quite a bit, but she causes trouble, so we want to send her back to UCL. And we say she should come in the winter. Leonie is over there, and so they'll be doing some of their education in Ghana. They'll come here for a semester. So when you see them, please be nice. I know you guys are nice and be kind. And then obviously the capacity development in terms of creating modules and centralizing training, implementation guidelines. Okay, so I'm going to say one or two things and play a video because I know we've been right. So first, how do you do this in practice? The first thing is from the very design stage. So right, you see here, myself and our team, Sarah, we all kind of co-developed, Audrey and all our team members co-developed our plan. Once we were done with that, if you want to work in the bureaucratic system, you go to the head. So we went to the minister, we met, talked about what we want to do, but to make sure that it is aligned with our policy. Then the other thing that the ministry did that was also quite innovative is not only are we informing them, but they have to also sign a clear terms of reference and then a pledge in terms of how to support and what role they want to play. Before you get to the municipal, you have to launch it nationally to get all the different ministries aware. So we did that national piece of it and also repeated the same thing. Then we went back to the local municipalities, the 5 that we shared with you. Then once you're done, if you ever work in intersectorial, one of the things you realize is that coordination is a big issue. It is a make or break of it. So we also have to come up with a communication plan. So Matilda here is working on that one. And then we change the way they do their meetings. So instead of the meetings being only about problem solving, we're also making the meetings about deliverables. Structuring around quarter. So when they come, they solve the problems in a way that will come up with the deliverables and then communicating that to them. And so I want to play a video so give you an idea of what in reality it looks like. That's a PR. So.
Regarding what was done in Argentina, I have no video. So, no, did that one. Well, we have the commitment of the 5 different municipalities. We set up a project with that intersectoral local committee in Argentina. We launched nationally to create awareness across all participating municipalities. We also set up a local intersectoral committee with clear terms of reference and agreements signed by the local authorities, but also with the support of the whole political spectrum, considering that during the project there will be elections, there will be changes in the political authorities, and what we want to learn from this project that this is possible to make a healthy transit in the political environment without destroying what has been done in the previous administration. This perhaps doesn't sound logic in northern countries, but in our countries, unfortunately, every change is to start again. Volver a empezar. And no, then we created instruments for data gathering and protocols to be implemented. The implementation of early child development and child rearing environmental surveys. So we have done a study for the first time in Argentina to evaluate early child development at the population level. The implementation of the situation analysis study that is ongoing, and we are in the final part of gathering and processing the information, and the creation of follow-up mechanisms with each of the municipalities, with people based in our team, like Mariela and Luciana, and also our counterparts at each municipal level. We also develop some materials for communication and create awareness on the project. Next one. For example, that iconography on what does it mean, children in all policies, and this project with the summary messages to be used by the community and policy leaders. And this is the information that has been distributed before the study of early child development at the community level. So this is an ongoing process together with communication strategy. Any comments, you?
They're beautiful. Yeah, no, I did.
Thank you. So next one. And to finalize this presentation, are we on time, Sarah?
Yes.
Okay.
Wrap it up.
I finished. No, the previous one. Well, this is the last part of the presentation. And on what have we learned? Do you want to start?
Okay. We are learning that there has to be some synergy between when you create policy, those who own the policy and those who implement. So in Ghana, the one who creates the policy is not the same as the one who implements the policy, and that creates different tensions and how do you get things done. So that's one thing that we're learning. We also thought that the Ghanaian unitary strict bureaucratic mechanism is a disadvantage, but we are realizing that once you also get the buy-in of the person at the top, you're also able to really go very, very far. So what we have learned is that if you want to go very far, in Ghana, it is very possible for you to go slow and you go very, very, very far. We also realizing that to overcome some of the governance structures, instead of just centralizing things for just local municipality and the national level, we are creating a new platform where both the national level policymakers who hold all the power comes in the same centralized place with the local implementers, so that we're able to escalate issues much quicker and able to kind of problem solve things a little bit easier. Right.
For the Argentina case, just a couple of main ideas in terms of the need to promote dialogue within and between sectors to overcome institutional fragmentation. This for us is a key issue. So although people are working in the same building, sometimes they're considered enemies or invaders. So we have to think that we all work on the same with the same purpose. And if the ministries exist, it's because the bureaucracy, because it's good for bureaucracy. What we want is to move from this comfort zone and to think on people, that most of the people, they don't live in the ministry, fortunately. The second is to increase planning skills, and this is something that Pablo is permanently pushing on the need to organize our work, to coordinate efforts, to prevent duplications, to use information and to take our decisions based on the real objective information. So this has to do with the increasing skills. And finally, considering our political structure, we need to coordinate the different levels of decision of the state, from the federal, province level, and municipal level. One is to improve the quality of the institution. The other is to move to the Ghana's model to become a unitarian country. So I think that this is the wish of the.
That's why I'll bury him in the shoe.
We have the model of Chile, but they are close to ours, is a unitarian country, and we consider it. But the main problem is of Argentina is there are too many Argentines. It was a joke. I'm sorry.
Okay, so we want to leave with some concluding thoughts. Mine is an invitation, and the invitation is, if you're a student, you want to participate in global policy work, and you want a diverse group of people, and you want to see different cultures and see it in real life, come and join us and work with us. If you're a faculty member looking for new collaborators, new way of thinking and doing things, we want to open up to you, because there's a job that not one person can do. So that'll be my thoughts.
Well, we are in a very conflicted world.
Mhm.
You know how children are suffering the consequence of grown-up people decisions. So I think that we grown-up people, we lost the battle. So if there is any chance to change the situation of our society, is to rescue children, the way of thinking, their values, in terms of children are honest, are transparent, not corrupted, they're not violent, they have fantasy, they're creators, they like to play. So I think that I don't say that we should become childish, but yes, to rescue the values of children in terms of reframing our society.
Thank you. Mira.
Thank you.